So as a orthopedic physical therapy clinic that specializes in sports medicine and manual therapy is a big component of what we do with our patients, especially in the early phases of rehab when they need it the most. We got to get that range of motion to be able to move forward to satisfy those functional patterns, right? Great. So just a little insight into how this process works. A lot of times we'll have a patient come on in. If we're going to work on some knee range of motion, getting them down on the table, might take a look at this patellofemoral joint mobility here if we're working on his knee, making sure everything's okay. Just a little bit of easy mobilization. You might take him up into some gentle flexion, extension type work. Tend to bias into flexion first, extension second, because we really want to work on that gait mechanic and having that terminal knee extension be something that we encourage. And if we have a lot of soft tissue restrictions or just tightness that's around that knee that might be restricting it, we have a few different ways that we can employ different tools to improve that mobility. So we can obviously use our hands, we can also use cups, and we can also use instrument-assisted soft tissue mobilization. So when we use the cups, a lot of times we'll just put a little bit of lotion on there, and all we're going to do is go ahead and get a little bit of negative pressure in there and then just slide it along that tissue, trying to get a little bit of improvement in those sliding surfaces. Doesn't have to be real aggressive. We're just trying to A, modulate the nervous system, but also B, just treat that tissue a little bit specifically. Secondarily, if we use instrument-assisted soft tissue mobilization, we don't need to get in there and dig real hard. Same thing, we just need to try to move through that tissue. Again, a huge component of this is neuromodulation, but we can work on all the tissue kind of around that knee. That patellar tendon can be really, really helpful in this phase of healing. If we finish with that and then go ahead and mobilize and then make sure we're getting all the range that we need to out of there, that's great. We'd also go ahead and look above and below, so we'll work on the ankle, work on the foot, work on the hip as well. Then it's a matter of turning on some of the muscles in the way that we want it. So if I really want him to tighten that quad, we can do some quad sets, but I can also manually resist him and just try to get a little bit of encouragement here. And restoring functional patterns, like restoring flexion range of motion is great, restoring extension range of motion is great, but it has to be functional. So right there, we just kicked in that terminal knee extension. Elijah, go ahead and stand up for me. Yep. And then next, we'd even just take them into, go ahead, can you straighten that knee for me in standing? So now we're gonna work on that terminal knee extension. Good, and I can even resist him at the hip too. Boom. Boom. And now we're getting him to walk a better. Good, step all the way through this time. Good, so again, we're taking that range of motion, we're taking some of those tactile cues and trying to put them into a bigger pattern. Why don't you step forward with that left foot, back with that right leg, and if he's gonna give me like a little bit of a lunge, I can even come in here and work on his tibial rotation and make sure everything's aligning really well. And similarly, I'm gonna have you go ahead and stand into a squat stance for me. Elijah, go ahead and give me a squat. Do the same thing where I can work on that tibial rotation, make sure the alignment through that patellofemoral joint's really good. And again, I'm going to use my manual skills, and we're going to use our manual therapy to reinforce and restore these functional patterns, because the next phase of rehab is going to be all about getting him stronger, right? So that's how we start our patients off. And we'll do as much of this as we need to through the healing process, and then get them lifting and training and getting stronger.